Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing Pneumonia 50 questions with answers and rationale. And if you would like one of our free audiobooks with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 72-year-old female patient with a history of COPD is admitted with complaints of a productive cough, shortness of breath, and fever. Chest X-ray confirms right lower lobe consolidation. Her arterial blood gas (ABG) results are as follows: pH 7.32, PaCO2 55 mm of mercury, PaO2 60 mm of mercury, and HCO3 26 milliequivalent per liter. What is the most appropriate nursing intervention? A. Administer oxygen via non-rebreather mask at 10 liters per minute. B. Initiate IV antibiotics immediately. C. Encourage deep breathing exercises and incentive spirometry. D. Prepare for intubation and mechanical ventilation. Correct answer, A. Rationale: the patient is in respiratory acidosis with hypoxemia, as indicated by the ABG results. Oxygen therapy is a priority to address hypoxemia. While antibiotics, B, are essential for treating pneumonia, they are not the immediate intervention for hypoxemia. Incentive spirometry, C, is supportive but not urgent, and intubation, D, is not indicated at this stage. Question 2. A 55-year-old male with type 2 diabetes presents with fever, chills, and pleuritic chest pain. Vital signs are as follows: temperature 39.0 degrees Celsius 102.2 degrees Fahrenheit, blood pressure 88/56 mm of mercury, heart rate 110, respirations 28 breaths per minute, and SpO2 85% on room air. What is the priority intervention? A. Administer a 1-liter bolus of normal saline. B. Start broad-spectrum IV antibiotics. C. Initiate oxygen therapy by nasal cannula at 2 liters per minute. D. Perform a sputum culture before administering antibiotics. Correct answer, A. Rationale: the patient is exhibiting signs of septic shock due to pneumonia, evidenced by hypotension and tachycardia. Fluid resuscitation is a priority to maintain perfusion. While antibiotics, B, are critical, they should be administered after initial stabilization. Oxygen at 2 liters per minute, C, is insufficient for severe hypoxemia, and sputum culture, D, can be delayed if it compromises treatment. Question 3. A 60-year-old postoperative patient develops fever, crackles in the left lung base, and a productive cough. His oxygen saturation drops to 88% on 2 liters nasal cannula. Which intervention should the nurse prioritize? A. Increase oxygen flow to 4 liters per minute. B. Notify the healthcare provider for further orders. C. Position the patient in high Fowlers. D. Obtain a chest X-ray. Correct answer, C. Rationale: positioning the patient in high Fowlers improves lung expansion and oxygenation. Increasing oxygen flow, A, is supportive but secondary to addressing position. A chest X-ray, D, and notifying the provider, B, are important but not the immediate priority. Question 4. A patient with pneumonia is receiving IV vancomycin. The nurse notes redness, itching, and flushing on the patient's upper body during the infusion. What is the most appropriate nursing action? A. Stop the infusion immediately and notify the provider. B. Slow the infusion rate and monitor the patient closely. C. Administer an antihistamine and continue the infusion. D. Document the reaction as an expected side effect. Correct answer, A. Rationale: the symptoms described are consistent with red man syndrome, a hypersensitivity reaction related to rapid vancomycin infusion. The infusion must be stopped immediately, and the provider should be notified for further orders, which may include restarting the infusion at a slower rate after symptoms subside or pre-medicating with antihistamines. Continuing the infusion without addressing the reaction, B or C, is inappropriate, and documenting without intervention, D, neglects patient safety. Question 5. A patient with bacterial pneumonia has been prescribed azithromycin. What lab finding would prompt the nurse to withhold the medication and notify the provider? A. Serum potassium of 3.5 milliequivalent per liter. B. ALT of 120. C. White blood cell count of 15,000. D. Hemoglobin of 11. Correct answer, B. Rationale: elevated ALT indicates potential liver impairment, and azithromycin can be hepatotoxic. The provider should be notified. The other values are within expected ranges or consistent with infection. Question 6. A patient admitted with pneumonia becomes increasingly agitated and restless. Arterial blood gas results show pH 7.48, P a CO2 30 mm of mercury, PaO2 65 mm of mercury, HCO3 24 milliequivalent per liter. What is the most appropriate intervention? A. Administer a sedative to calm the patient. B. Increase oxygen delivery to maintain SpO2 greater than 90%. C. Encourage deep breathing to correct hyperventilation. D. Prepare for intubation. Correct answer, B. Rationale: the ABG indicates respiratory alkalosis with hypoxemia. The priority is to address hypoxemia by increasing oxygen delivery. Sedation, A, and preparation for intubation, D, are not indicated at this stage. Question 7. A patient diagnosed with aspiration pneumonia has a nasogastric tube in place. What is the priority nursing action to prevent further complications? A. Ensure the tube is clamped between feedings. B. Monitor for residual volume before administering feedings. C. Elevate the head of the bed to at least 30 degrees. D. Irrigate the tube with 30 milliliters of sterile water every 4 hours. Correct answer, C. Rationale: elevating the head of the bed minimizes the risk of aspiration. While other options are appropriate, they do not directly address the prevention of aspiration pneumonia. Question 8. A patient receiving oxygen therapy for pneumonia complains of a dry mouth and headache. What is the most appropriate nursing action? A. Decrease the oxygen flow rate. B. Increase fluid intake and provide oral care. C. Notify the healthcare provider immediately. D. Discontinue oxygen therapy. Correct answer, B. Rationale: dry mouth and headache can result from oxygen therapy, and supportive care like hydration and oral care is appropriate. Decreasing oxygen, A, or discontinuing therapy, D, is unsafe. Question 9. A patient with pneumonia is at risk for acute respiratory distress syndrome, ARDS. Which finding should alert the nurse to this complication? A. Persistent cough with purulent sputum. B. Sudden onset of severe dyspnea and hypoxemia unresponsive to oxygen therapy. C. Decreased white blood cell count. D. Hyperresonance on lung percussion. Correct answer, B. Rationale: ARDS presents as sudden, severe dyspnea and refractory hypoxemia. Persistent cough, A, and other options do not indicate ARDS. Question 10. A patient with a history of stroke and dysphagia is admitted with pneumonia. Which nursing intervention is most important to prevent aspiration? A. Administer antibiotics as prescribed. B. Provide thickened liquids and monitor swallowing. C. Encourage the patient to drink fluids frequently. D. Perform oral suctioning every 2 hours. Correct answer, B. Rationale: providing thickened liquids and monitoring swallowing reduces the risk of aspiration. Frequent fluids, C, and suctioning, D, are secondary interventions. Question 11. A 45-year-old patient with community-acquired pneumonia develops confusion, agitation, and hypotension. Laboratory findings reveal an elevated lactate level of 4.5 millimoles per liter and white blood cell count of 22,000. What is the most appropriate intervention? A. Administer IV fluids and titrate to maintain a MAP greater than 65 mm of mercury. B. Increase oxygen delivery to maintain SpO2 greater than 94%. C. Obtain blood cultures before administering IV antibiotics. D. Initiate norepinephrine infusion immediately. Correct answer, A. Rationale: the patient is exhibiting signs of sepsis with potential septic shock, requiring fluid resuscitation to improve perfusion. Blood cultures, C, and antibiotics are essential, but should follow fluid resuscitation. Norepinephrine, D, is only indicated if fluid resuscitation fails. Question 12. A patient with pneumonia is receiving ceftriaxone IV. On assessment, the nurse notes swelling and tenderness at the IV site. What is the next best action? A. Discontinue the IV and restart it in a different vein. B. Apply a warm compress to the affected site. C. Notify the healthcare provider. D. Flush the IV with normal saline and continue the infusion. Correct answer, A. Rationale: swelling and tenderness suggest infiltration or phlebitis, requiring the IV to be discontinued and restarted elsewhere. Continuing the infusion, D, could worsen the issue, and notifying the provider, C, is not the first step. Question 13. A patient with hospital-acquired pneumonia has worsening dyspnea and crackles in both lung bases. The nurse notes the following ABG results: pH 7.29, PaCO2 52 mm of mercury, PaO2 58 mm of mercury, HCO3 24 milliequivalent per liter. What is the most appropriate nursing action? A. Administer a bronchodilator as prescribed. B. Increase oxygen delivery to maintain SpO2 greater than 90%. C. Prepare the patient for endotracheal intubation. D. Position the patient in a high Fowler's position. Correct answer, C. Rationale: the ABG indicates acute respiratory failure, respiratory acidosis with hypoxemia. Intubation and mechanical ventilation are necessary to improve oxygenation and remove CO2. Increasing oxygen, B, or positioning, D, is supportive but insufficient in this case. Question 14. A 78-year-old male patient is admitted with pneumonia and confusion. He has a history of dementia and is pulling at his oxygen tubing. What is the nurse's best intervention? A. Restrain the patient's hands to prevent removal of oxygen. B. Reassess the need for oxygen therapy. C. Administer a prescribed sedative to calm the patient. D. Use a nasal cannula and provide reassurance. Correct answer, D. Rationale: using a nasal cannula provides a less obtrusive method of oxygen delivery, and reassurance can help calm the patient. Restraints, A, are a last resort, and reassessing oxygen therapy, B, is inappropriate if hypoxemia is present. Question 15. A patient with pneumonia is being treated with IV levofloxacin. The patient reports tendon pain in the Achilles area. What is the most appropriate action by the nurse? A. Notify the healthcare provider immediately. B. Administer acetaminophen for pain relief. C. Encourage ambulation to reduce stiffness. D. Apply a cold compress to the affected area. Correct answer, A. Rationale: tendon pain could indicate tendinitis or rupture, a rare but serious side effect of fluoroquinolones like levofloxacin. The provider must be notified to discontinue the medication. Question 16. A 36-year-old patient with severe pneumonia develops a pleural effusion. The provider performs a thoracentesis to remove fluid. Which assessment finding post-procedure requires immediate action? A. Diminished breath sounds on the affected side. B. Oxygen saturation of 94% on room air. C. Sudden onset of sharp chest pain and dyspnea. D. Blood-tinged fluid in the drainage container. Correct answer, C. Rationale: sharp chest pain and dyspnea may indicate a pneumothorax, a potential complication of thoracentesis. This requires immediate evaluation. Diminished breath sounds, A, are expected initially. Question 17. A patient with pneumonia develops acute kidney injury, AKI, after receiving IV vancomycin? Which lab value is most concerning? A. Blood urea nitrogen, BUN, of 32 mg per deciliter. B. Creatinine level of 2.5 mg per deciliter. C. Potassium level of 4.8 milliequivalent per liter. D. White blood cell count of 14,000. Correct answer, B. Rationale: a creatinine level of 2.5 mg per deciliter indicates significant kidney dysfunction. Vancomycin is nephrotoxic, and the dose may need adjustment or discontinuation. Question 18. A patient with pneumonia is found to have a PaO2 and FiO2 ratio of 150. What complication should the nurse suspect? A. Acute respiratory distress syndrome, ARDS. B. Pulmonary embolism. C. Severe sepsis. D. Pneumothorax. Correct answer, A. Rationale: a PaO2 and FiO2 ratio less than or equal to 200 is diagnostic for ARDS. This finding suggests significant hypoxemia requiring aggressive management. Question 19. A 50-year-old patient with pneumonia is receiving high-flow oxygen therapy. The nurse notices the patient is becoming increasingly lethargic and retaining CO2. What is the best action? A. Increase oxygen flow to maintain SpO2 greater than 95%. B. Notify the provider to consider non-invasive ventilation. C. Decrease oxygen flow to prevent CO2 retention. D. Perform frequent neurological checks. Correct answer, B. Rationale: high oxygen levels in some patients with chronic lung disease can suppress the respiratory drive and lead to CO2 retention. Non-invasive ventilation supports ventilation and oxygenation. Question 20. A 68-year-old patient with pneumonia is receiving IV fluids for dehydration. The nurse notes crackles in the lung bases and jugular vein distension. What is the most appropriate intervention? A. Stop the IV fluids immediately. B. Administer a diuretic as prescribed. C. Notify the provider and prepare for intubation. D. Position the patient flat to improve perfusion. Correct answer, B. Rationale: crackles and jugular vein distension suggest fluid overload. A diuretic can help reduce fluid volume and relieve symptoms. Stopping fluids, A, or preparing for intubation, C, is unnecessary unless respiratory status worsens. Question 21. A 40-year-old patient with pneumonia reports increased shortness of breath and chest discomfort during inspiration. Upon assessment, the nurse notes decreased breath sounds and dullness to percussion over the left lower lung field. What is the most appropriate nursing intervention? A. Encourage the patient to use an incentive spirometer. B. Notify the healthcare provider for potential thoracentesis. C. Increase the oxygen flow rate to maintain SpO2 greater than 92%. D. Position the patient on the affected side. Correct answer, B. Rationale: decreased breath sounds and dullness to percussion suggest a pleural effusion, which may require a thoracentesis for diagnosis and treatment. While oxygen therapy, C, and incentive spirometry, A, are supportive, addressing the underlying cause is the priority. Question 22. A patient with severe pneumonia is prescribed methylprednisolone. The nurse should monitor for which adverse effect associated with this medication. A. Hypoglycemia. B. Decreased white blood cell count. C. Increased risk of infection. D. Bradycardia. Correct answer, C. Rationale: corticosteroids like methylprednisolone suppress the immune response, increasing the risk of infection. Hyperglycemia, not hypoglycemia, is a more likely side effect. A decreased WBC count and bradycardia are not typical concerns with this medication. Question 23. A patient with pneumonia develops new onset atrial fibrillation with a rapid ventricular rate, RVR. What is the nurse's priority action? A. Administer a beta blocker as prescribed. B. Notify the healthcare provider immediately. C. Initiate continuous cardiac monitoring. D. Assess the patient's electrolyte levels. Correct answer, C. Rationale: continuous cardiac monitoring is crucial for detecting arrhythmias and monitoring rate control. While notifying the provider, B, and addressing electrolyte imbalances, D, are important, they are not the immediate priority. Question 24. A 52-year-old patient with pneumonia reports severe fatigue and inability to perform daily activities. What nursing diagnosis is most appropriate? A. Activity intolerance related to impaired oxygenation. B. Impaired gas exchange related to alveolar capillary membrane changes. C. Risk for infection related to immunosuppression. D. Fatigue related to increased metabolic demand. Correct answer, A. Rationale: the patient's report of severe fatigue and inability to perform activities aligns with the nursing diagnosis of activity intolerance. Impaired gas exchange, B, is relevant but not specific to this subjective report. Question 25. A patient with aspiration pneumonia is receiving enteral tube feedings. Which nursing intervention is most important to prevent further complications? A. Administer feedings at room temperature. B. Check for gastric residual volume every 6 hours. C. Maintain the head of the bed elevated at 45 degrees. D. Flush the tube with 30 ml sterile water before feedings. Correct answer, C. Rationale: elevating the head of the bed minimizes the risk of aspiration. While checking residual volume, B, and flushing the tube, D, are important, positioning has the greatest impact on reducing aspiration risk. Question 26. A patient with pneumonia is found to have a new oxygen saturation of 82% on room air, with respiratory rate at 30 breaths per minute. What is the nurse's first action? A. Notify the healthcare provider for intubation. B. Initiate oxygen therapy via non-rebreather mask. C. Place the patient in a supine position to improve perfusion. D. Obtain a repeat arterial blood gas analysis. Correct answer, B. Rationale: severe hypoxemia requires immediate oxygen therapy to stabilize the patient. Intubation, A, may be needed later but is not the first action. A supine position, C, may worsen breathing. Question 27. A patient with pneumonia is prescribed albuterol nebulization every 4 hours. The nurse should monitor for which side effect of this medication? A. Bradycardia. B. Hyperkalemia. C. Tachycardia. D. Hypotension. Correct answer, C. Rationale: albuterol, a beta agonist, can cause tachycardia as a common side effect. Bradycardia, hyperkalemia, and hypotension are not associated with this medication. Question 28. A 63-year-old patient admitted with pneumonia develops hemoptysis and severe pleuritic chest pain. A chest CT shows a large infiltrate in the left lung. What complication should the nurse suspect? A. Pulmonary embolism. B. Lung abscess. C. Acute respiratory distress syndrome, ARDS. D. Pleural effusion. Correct answer, B. Rationale: hemoptysis and a large infiltrate on imaging are indicative of a lung abscess, a complication of severe pneumonia. Pulmonary embolism, A, and ARDS, C, have different clinical presentations. Question 29. A patient with pneumonia is started on IV aminoglycosides. Which lab value should the nurse prioritize monitoring? A. Serum calcium levels. B. Creatinine levels. C. White blood cell count. D. Serum sodium levels. Correct answer, B. Rationale: aminoglycosides are nephrotoxic, so monitoring creatinine levels is essential. Other lab values are not directly impacted by this medication. Question 30. A patient recovering from pneumonia reports persistent night sweats and unintentional weight loss. What condition should the nurse suspect? A. Tuberculosis. B. Recurrent pneumonia. C. Bronchiectasis. D. Chronic obstructive pulmonary disease, COPD. Correct answer, A. Rationale: night sweats and unintentional weight loss are hallmark symptoms of tuberculosis, which can occur as a secondary infection following pneumonia. Other conditions are less likely based on the given symptoms. Question 31. A 58-year-old patient with pneumonia develops worsening dyspnea, cyanosis, and a respiratory rate of 34. Despite being on 60% oxygen via a Venturi mask, the patient's SpO2 remains at 84%. What is the most appropriate next action? A. Initiate high-flow nasal cannula oxygen therapy. B. Prepare for intubation and mechanical ventilation. C. Switch to a non-rebreather mask at 15 liters per minute. D. Administer a sedative to reduce respiratory distress. Correct answer, B. Rationale: the patient is experiencing acute respiratory failure with hypoxemia unresponsive to oxygen therapy. Intubation and mechanical ventilation are required to support oxygenation and ventilation. High-flow oxygen, A, or a non-rebreather mask, C, may not be sufficient in severe cases. Question 32. A patient with pneumonia is prescribed IV vancomycin. The nurse notices a trough level of 25 micrograms per milliliter. What is the best nursing action? A. Administer the next dose as scheduled. B. Hold the next dose and notify the provider. C. Increase the infusion rate to avoid delays. D. Monitor the patient for signs of ototoxicity. Correct answer, B. Rationale: a vancomycin trough level of 25 micrograms per milliliter is above the therapeutic range of 10 to 20 micrograms per milliliter, increasing the risk of toxicity. The next dose should be held, and the provider notified for dose adjustment. Question 33. A patient with pneumonia develops confusion and a sudden drop in blood pressure. The nurse notes cool, clammy skin and a weak, thready pulse. What complication should the nurse suspect? A. Pulmonary embolism. B. Septic shock. C. Pleural effusion. D. Myocardial infarction. Correct answer, B. Rationale: the patient exhibits signs of septic shock, a severe complication of pneumonia characterized by hypotension, confusion, and signs of poor perfusion. Other options do not fully explain the clinical presentation. Question 34. A patient with pneumonia complains of sudden, sharp chest pain that worsens with deep breaths. The nurse notes decreased breath sounds on the right side and SpO2 of 88% on room air. What is the priority action? A. Administer pain medication to alleviate discomfort. B. Notify the healthcare provider for further evaluation. C. Encourage incentive spirometry to improve lung expansion. D. Perform a focused respiratory assessment. Correct answer, B. Rationale: the patient's symptoms suggest a pneumothorax or pleural effusion, both of which require prompt evaluation and intervention. While a focused assessment, D, is helpful, immediate provider notification is critical. Question 35. A patient with pneumonia is prescribed a new antibiotic regimen. What finding would prompt the nurse to withhold the next dose and notify the provider? A. Mild nausea after administration. B. Red, raised rash on the chest and arms. C. Temperature of 37.8 degrees Celsius, 100 degrees Fahrenheit. D. Blood pressure of 110/70 millimeters of mercury. Correct answer, B. Rationale: a red, raised rash may indicate an allergic reaction, which requires immediate provider notification and discontinuation of the medication. The other findings are not indicative of an adverse reaction. Question 36. A patient with pneumonia is receiving IV fluids to treat dehydration. On assessment, the nurse notes increased crackles, abounding pulse, and jugular vein distension. What is the priority nursing intervention? A. Administer prescribed diuretics and monitor urine output. B. Discontinue IV fluids immediately. C. Notify the healthcare provider for further orders. D. Reduce the IV fluid infusion rate. Correct answer, D. Rationale: signs of fluid overload require reducing the infusion rate as a first step. Discontinuing fluids, B, or administering diuretics, A, may be appropriate later, but immediate adjustment of the rate is essential to prevent further complications. Question 37. A patient recovering from pneumonia reports persistent fatigue and reduced exercise tolerance. What teaching should the nurse provide to promote recovery? A. Start regular physical activity to regain strength. B. Schedule frequent rest periods throughout the day. C. Avoid any physical activity for at least 4 weeks. D. Increase caffeine intake to combat fatigue. Correct answer, B. Rationale: rest is essential during recovery from pneumonia, especially when the patient reports fatigue. Gradual activity resumption is encouraged, but overexertion should be avoided. Question 38. A 70-year-old patient is admitted with pneumonia and shows a new onset of atrial fibrillation. Which diagnostic test would be most relevant to determine the underlying cause? A. Chest X-ray. B. Serum electrolyte levels. C. Arterial blood gas analysis. D. Echocardiogram. Correct answer, B. Rationale: electrolyte imbalances, such as hypokalemia or hypomagnesemia, can precipitate arrhythmias. Addressing these imbalances is critical in managing atrial fibrillation. Question 39. A patient with severe pneumonia develops respiratory acidosis with ABG results, pH 7.25, PaCO2 60 mm of mercury, PaO2 55 mm of mercury, HCO3 24 milliequivalent per liter. What is the nurse's priority action? A. Encourage deep breathing and coughing exercises. B. Administer bronchodilator as prescribed. C. Notify the provider to prepare for mechanical ventilation. D. Increase oxygen flow to 10 liters per minute by face mask. Correct answer, C. Rationale: respiratory acidosis with hypoxemia suggests impending respiratory failure, requiring mechanical ventilation. Increasing oxygen, D, or using bronchodilators, B, alone is insufficient in severe cases. Question 40. A patient with pneumonia reports a new onset of frequent diarrhea after starting antibiotics. What condition should the nurse suspect? A. Clostridioides difficile infection. B. Adverse reaction to antibiotics. C. Foodborne illness. D. Dehydration. Correct answer, A. Rationale: new onset diarrhea after antibiotics may indicate a C. difficile infection, a common complication of antibiotic therapy. The provider should be notified for further testing and treatment. Question 41. A 64-year-old patient with pneumonia is receiving high-dose corticosteroid therapy. Which laboratory result would indicate the need for immediate intervention? A. Glucose level of 190 mg per deciliter. B. Potassium level of 2.8 milliequivalent per liter. C. White blood cell count of 12,000. D. Hemoglobin of 13.5 grams per deciliter. Correct answer, B. Rationale: corticosteroids can cause hypokalemia, and a potassium level of 2.8 milliequivalent per liter is critically low and requires prompt correction. Hyperglycemia, A, and a mild increase in WBC count, C, are expected side effects of corticosteroids. Question 42. A patient with pneumonia is receiving IV piperacillin tazobactam. After 15 minutes of infusion, the patient reports difficulty breathing and itching. What is the nurse's priority action? A. Stop the infusion immediately. B. Administer epinephrine intramuscularly. C. Notify the healthcare provider. D. Apply a cold compress to the infusion site. Correct answer, A. Rationale: the patient is showing signs of a possible anaphylactic reaction. The infusion must be stopped immediately, followed by administering epinephrine, B, as per protocol. Provider notification, C, is secondary after stabilizing the patient. Question 43. A patient with pneumonia develops severe hypoxemia and hypotension despite receiving oxygen therapy. The nurse suspects septic shock. Which set of interventions is the priority? A. Administer vasopressors, draw lactate levels, and monitor hourly urine output. B. Increase oxygen to 100%, administer antibiotics, and collect sputum samples. C. Administer IV fluids, draw blood cultures, and start broad-spectrum antibiotics. D. Obtain an arterial blood gas analysis, administer antipyretics, and notify the provider. Correct answer, C. Rationale: septic shock requires immediate fluid resuscitation, identification of the causative organism, blood cultures, and early antibiotic therapy. While vasopressors, may be needed later, fluids and antibiotics are the priority. Question 44. A patient with pneumonia reports persistent, sharp chest pain that worsens with breathing. A pleural rub is auscultated on the lower right lung field. What complication is most likely? A. Pleural effusion. B. Pulmonary embolism. C. Pleuritis. D. Acute respiratory distress syndrome, ARDS. Correct answer, C. Rationale: a pleural rub and sharp, localized pain with breathing indicate pleuritis, inflammation of the pleura, a common complication of pneumonia. Pleural effusion, would likely present with decreased breath sounds, not a pleural rub. Question 45. A 70-year-old patient with pneumonia is being discharged on azithromycin. What teaching should the nurse include about this medication? A. Avoid direct sunlight, as this medication may cause photosensitivity. B. Take the medication with food to enhance absorption. C. Complete the entire course of the antibiotic, even if you feel better. D. Avoid taking this medication with dairy products. Correct answer, C. Rationale: patients must complete the full course of antibiotics to ensure complete eradication of the infection. Photosensitivity, is not common with azithromycin, and taking it with food, B, is optional, not necessary. Question 46. A patient with pneumonia and chronic kidney disease, CKD, is prescribed levofloxacin. Which nursing action is most important before administering the first dose? A. Assess for a history of penicillin allergy. B. Obtain baseline creatinine levels. C. Monitor for signs of gastrointestinal distress. D. Educate the patient about potential tendon pain. Correct answer, B. Rationale: levofloxacin requires renal dosing adjustments in patients with CKD. Obtaining baseline kidney function ensures appropriate dosing to prevent toxicity. Question 47. A patient recovering from pneumonia reports increasing difficulty breathing and fatigue over the last 24 hours. Auscultation reveals wheezing in both lung fields. What is the priority nursing action? A. Administer a prescribed bronchodilator via nebulizer. B. Notify the healthcare provider for a chest X-ray. C. Encourage incentive spirometry to improve oxygenation. D. Assess oxygen saturation and apply supplemental oxygen. Correct answer, D. Rationale: the priority is to assess and stabilize oxygenation. Administering bronchodilators, A, and notifying the provider, B, may follow after addressing oxygenation. Question 48. A patient with pneumonia reports a sore throat and difficulty swallowing after receiving inhaled corticosteroids. What teaching should the nurse provide? A. Stop taking the inhaler immediately and contact your provider. B. This is a normal side effect and should resolve on its own. C. Rinse your mouth thoroughly with water after each use of the inhaler. D. Take the corticosteroid with food to prevent throat irritation. Correct answer, C. Rationale: rinsing the mouth after using inhaled corticosteroids helps prevent oral thrush, which may cause a sore throat. Stopping the inhaler, A, is unnecessary. Question 49. A patient with pneumonia is found to have a blood pressure of 86/54 mm of mercury, heart rate of 124 and urine output of 15 milliliters over the past 2 hours. What complication is the nurse most concerned about? A. Acute kidney injury. B. Cardiogenic shock. C. Septic shock. D. Pulmonary embolism. Correct answer, C. Rationale: the combination of hypotension, tachycardia, and low urine output is consistent with septic shock, a potential complication of severe pneumonia. Question 50. A 66-year-old patient with pneumonia is receiving IV antibiotics. On the third day, the patient reports persistent diarrhea with mucus. What is the most appropriate nursing intervention? A. Notify the provider and request testing for C. difficile. B. Encourage increased fluid intake to prevent dehydration. C. Discontinue the antibiotic therapy immediately. D. Provide antidiarrheal medication to reduce symptoms. Correct answer, A. Rationale: persistent diarrhea with mucus may indicate C. difficile infection, a complication of antibiotic use. Early diagnosis and treatment are critical. Stopping antibiotics, C, without consultation is inappropriate.